to Carers New South Wales webinar on what's changed in aged care for carers this 3rd of November 2025. My name is Melissa Blaine-Woodley and I'm the Acting Policy and Development Manager at Carers New South Wales. And I have the privilege of introducing today's session with the help of my colleague, Lauren. Lauren will be in the chat, sharing helpful links and answering questions as we go. Before we begin, I would like to acknowledge the Gorigal people of the Eora Nation, the traditional owners on the lands upon which we are joining from here today in the North Sydney office. I would also like to acknowledge the traditional owners of the lands on which you are joining from today and pay my respects to elders past, present and emerging, and to any Aboriginal and Torres Strait Islanders on the call today. So welcome everyone to today's session, What's Changed in Aged Care for Carers? We know that navigating aged care as a carer can be stressful and confusing, especially when changes are happening. Today, we'll break down what the key changes are and what they mean for you as someone caring for an older person. When we talk about older people, we will be using the same definition that the aged care system uses, which is those aged 65 years and older, or 50 years older for Aboriginal and Torres Strait Islander people. We hope that this session will answer some of your questions. It closely follows the fact sheet which we have developed on the same topic based on questions we have received. Throughout the webinar, we will also share where you can find more information and support on particular topics. After the event, we will be collating questions into a fact sheet and publishing this on our Aged Care Hub reform page. Lauren is sharing the link to the hub now, as this is regularly updated with new details and resources on changes to aged care. Today, we'll cover who Carers New South Wales is, who carers of older people are, why aged care is changing, what's changed and how it affects carers, where to find support and information, and we'll finish with the Q&A. Please note that this session will be recorded and emailed to you after the end of today's session. We kindly ask that you please keep your microphones on mute and limit your questions and comments to the chat during the presentation. If time permits, we will answer some questions submitted via the registration form and chat. Otherwise, we'll take questions on notice and send out a frequently asked questions fact sheet along with the recording. For those of you who are unfamiliar with Carers New South Wales, Carers New South Wales is the peak non-government organisation for family and friend carers in New South Wales. We support carers of all ages and backgrounds, whether they're caring for someone who is age-related needs, disability, mental illness, or chronic health conditions. We also deliver the Carer Gateway in several regions and advocate for carer-inclusive policies and services. A little bit about carers. Who are carers? Well, carers provide unpaid care and support to family members or a friend who has a disability, mental illness, drug and alcohol dependency, chronic conditions, terminal illness, or who is frail. There's approximately 958,500 carers across New South Wales. The definition does not include paid care workers, formal volunteers, parents, foster carers, kinship carers. A carer may be a parent, partner, sibling, relative, friend, or child, a younger carer of the person requiring care. The Australian government is making several changes to how aged care is funded delivered, and monitored. These changes are known as the aged care reforms. Many of these changes are based on what the Aged Care Royal Commission found when they listened to older people, families, carers, aged care staff, and many others about the issues in aged care. What they found was the current aged care system is no longer fit for purpose. Some of the key problems raised included aged care is hard to access and understand. It's tough to know what services are good quality. Too many people have experienced poor care and abuse. Residential care is often understaffed and underfunded. Home care fees can be confusing and too high. Carers haven't been heard properly or supported. A new law called the Aged Care Act 2024 was passed last November and started from the 1st of November 2025. This new act will be the main policy that will set out who can access government-funded aged care services and how they should be delivered. This was the number one recommendation from the Aged Care Royal Commission. The Act aims to put the rights and well-beings of older people at the centre of the aged care system. The new Act includes a statement of rights and principles, which sets out the rights of older people and what they should expect when seeking or accessing government-funded aged care services. This includes the rights of older people to receive support and stay connected to their families and friends. The Act formally recognises the valuable contributions carers make to society and the people they care for. Referencing the Commonwealth Carer Recognition Act 2010, the Act states that carers should be considered partners with registered providers who deliver funded aged care services. The role of carers and advocates should be acknowledged, respected, and supported in improving older people's experiences with the aged care system. How you access aged care services will stay the same. My Aged Care will continue to be the main entry point to accessing aged care services. From the 1st of November, a new registered supporter role has replaced the previous representative arrangements. Anyone registered as a representative from the 30th of June 2025 has automatically transitioned to the new supporter role unless you have opted out. If you would like to check your status or opt out, you can call My Aged Care or access your online account. The role of the new registered supporter is to promote the rights, wills, preferences, and well-being of the older person receiving aged care services. Let's delve into the different types of registered supporters available. Firstly, the standard supporter role focuses on helping the older person express their will and preferences. This role involves helping the person you care for make and communicate decisions, promote the will and preferences of the person you care for, and avoid managing conflicts of interest. Supporters will automatically receive aged care information about the person they care for. It is important to note that they cannot make decisions on behalf of the person they care for. Next, we have the supporter light role. The light version also involves assisting with decision making and communication, promoting the older person's preferences, and managing potential conflicts. Unlike the standard supporter role, Supporter Light will not automatically receive information about the older person, but can request the information. They cannot make decisions on their behalf. Finally, the supporter guardian role encompasses all of the responsibilities of the previous roles, but allows for decision making on behalf of the older person. This role is where you are not only a registered supporter, but also have legal decision making arrangements, such as an enduring power of attorney or guardianship arrangements. Again, there may be certain things you will be able to make decisions on behalf of the person you care for, and others where you cannot. And these areas are based on your legal decision making arrangements. For further information, you can register. Sorry, start that again. For further details, you can refer to the Registered Support Policy Library on the department's website. Let me say that again. For further details, you can refer to the Registered Supporters Policy Library on the department's website or the Supported Decision Making Resources via the OPAN website. Does anyone have any questions about this particular slide? We're happy to take questions on notice and answer them later on as well. Once you've registered with My Aged Care, you and the person you care for can begin the assessment process to access government-funded aged care services. Aged care assessments have changed to make it easier for you and the person you care for to enter aged care. Rather than multiple different assessment pathways and teams, there is a new single assessment workforce and an integrated assessment tool to assess eligibility for government-funded aged care services. These changes started last year, and while some updates are happening behind the scenes, you might notice assessors asking you for your contact details, information about your caring role, and what supports you need to keep caring. The new tool includes a carer profile section. And with the older person's consent, assessors are required to involve you in discussions about care and supporting planning. The assessor will work with the older person and their carer to develop an individual support plan, which includes a summary of their needs and goals, what services they're eligible for, their funding level, and quarterly budget. There is now a new program called Support at Home, and this will bring all in-home and community aged care programs together to make it easier for older people to access services and supports that help them live independently in home and in the community for longer. The program will be rolled out in 2 stages. Support at Home has replaced the Home Care Packages Program, the HCP, and short-term restorative care, known as STRC, programs from the 1st of November 2025. The Commonwealth Home Support Program, known as CHSP, apologies for all the acronyms, it's just what they use, will also transition to support at home no earlier than the 1st of July 2027. The new program offers a range of in-home and community-based services, including clinical care such as nursing and occupational therapy, independence such as personal care and respite, and everyday living such as cleaning, gardening, and meal preparation, care management services such as care planning and service coordination, and there will be a new funding classification that determines an older person's quarterly budget. For older people with a home care package, they will not have to be reassessed under the Support at Home program. They will continue to receive an equivalent funding level unless their needs change. There are 8 funding classifications for ongoing aged care services and 3 short-term funding classifications. These short-term pathways are the assistive technology and home modification schemes, restorative care pathway, previously known as short-term restorative care program, and the end of life pathway. Older people will be able to access care management services delivered by care partners. These include planning and coordinating services, monitoring, reviewing and evaluating care plans, support and education, including clinical advice. Older people can also self-manage their aged care services. This can look like choosing and coordinating services to meet their care needs and goals, choosing their own aged care worker, scheduling when their services are delivered, communicating with their workers and provider, and paying invoices for services. Service providers are still required to ensure the quality and safety of services even when older people self-manage. Regardless of whether the older person you care for receives case management or manages their aged care themselves, all participants will have 10% deducted from their quarterly budget for care management. This will go to the provider care management account, and it is pulled together with other care management funding from all other participants. Under the new strengthened quality standards, service providers are required to include carers in care management activities. Under the new Support at Home program, older people will receive a budget every 3 months to help cover the services they need. This will be based on their care needs and are documented in the support plan. So what this means for you as a carer is older people will only pay for the services they receive. How much they pay will be based on the type of service and the age pension means test. Clinical care will be fully funded by the government. Older people will make co-contributions for independence and everyday living services. Providers will work with older people to develop individualised plans, budgets. The government has banned entry, exit, and other hidden fees to ensure clearer and fairer pricing. This includes separate administration or travel fees. People who are already in aged care will not need to pay more under the new system. They will pay the same fees under the no worse off principle or the grandfathering arrangements. You will be able to see the prices of service providers delivery on the My Aged Care website through the Find a Provider tool. The government has also provided pricing guidance to support older people and their carers to understand standard pricing and consumer protections. The older person can negotiate a different price, and the agreed upon price will be documented in their service agreement. If you don't spend your full budget each quarter, you can carry over unspent funds of $1,000 or 10% of your quarterly budget, whichever is greater. This will be automatically carried over in the older person's home support account to the next quarterly budget period. Please note that the funding for the at-home home modifications assisted technology home modifications is valid for 12 months. There has also been changes to improve the quality and safety of aged care. The new Act includes a clearer picture of high quality care that values the connections of older people have with their family and carers. It has also introduced the strengthened aged care quality standards. The quality standards outline the outcomes and the levels of care that you can expect when accessing aged care services. The strengthened quality standards include greater requirements for providers to recognise, support, and include carers at multiple stages on the aged care journey. Under the new quality standards, aged care providers are required to recognise supporters as having an important role in assisting and providing um, prov- start that again. Recognize supporters as having an important role in assisting or providing funded aged care services. Recognize and engage with supporters and partners in the planning, delivery, review of the older person's care in line with the older person's wishes. Sharing timely and accessible information about the older person's needs and care to the older person and their supporters. Communicate the outcomes of assessment and planning to the older person and their supporters in a way which they understand with the older person's informed consent. Involve supporters where possible for individuals who require support with decision making, and partner with older people and their supporters in reviewing emergency and disaster management plans. Support older people and their supporters in reporting incidences and encourage their involvement in identifying ways to reduce incidences from occurring. Encouraging older people and their supporters to make a complaint and give feedback. Provide ways for supporters to escalate concerns about safety or well-being. These changes aim to make aged care more inclusive, transparent, and supportive for both the older person and their carers. So we've talked about what's changed. Now let's look at something that's still in progress, which is finalising service agreements. A service agreement is basically a contract between the older person and their provider. It explains what services will be delivered, how much they will cost, the terms and conditions. Under the new Support at Home program, everyone will need a new or updated service agreement. This is to make sure the agreement reflects the new services and prices. What does this mean for you as a carer? You can help the person you care for by reviewing the agreement together, asking questions, negotiating changes or temporary arrangements before signing. The person you care for doesn't have to sign straight away. They can wait until Services Australia confirms their contribution rate. Services Australia will send a letter and that rate, and once it's confirmed, the older person will have 90 days to sign the agreement, and the provider has 30 days to start the conversation with the older person. What to do now? Check Services Australia has up-to-date income and assessment details about the person you care for to make sure contribution rates are accurate. Keep an eye out for the letter with their contribution rate from Services Australia. Review the contribution rate and service agreement with the person you care for and their provider, and don't be afraid to ask questions. And most importantly, know your rights. Providers must explain the agreement clearly and the costs associated. They cannot charge new prices unless the older person agrees in writing. Services will keep going during the transition, even if the agreement isn't signed. yet. Providers can only stop services in very specific situations. Every agreement must include a complaints and feedback process for older people and carers. On our slides, we have linked to a number of places where you can access specific information about the key topics discussed. So you will be able to click on the links once the slides are shared. You will notice that most of the links on the slide are to information and resources from the Aged Care Quality and Safety Commission, the Department of Health, Aging, and My Aged Care. They can provide you with up-to-date information about the latest changes to aged care. If you have any questions about the changes to aged care, you can speak with your aged care service provider, contact My Aged Care or an aged care specialist officer at Service Service Australia. Sorry to repeat that, Services Australia. If you have a complaint about your support at home agreement or pricing, you can speak to the Aged Care Quality and Safety Commission, which will be able to investigate and take regulatory action where required. You can also access free and confidential information and advocacy through the Older Persons Advocacy Network, OPAN. OPAN has an aged care advocacy line where an advocate can assist you with information to help discuss your support at home agreement or pricing with your provider. You can also visit the Carers New South Wales Aged Care Hub online, and it will provide you with the most up-to-date information. I'm going to leave it there. You can go and do some research after the webinar. But on behalf of Carers New South Wales, I would like to extend a thank you to those of you who have attended today, and hopefully this webinar has been answered some of your questions. Just a reminder that we will be sharing a recording of this webinar and a fact sheet on the Carers New South Wales Aged Care Hub, the one we just showed you. And if you have any more questions or would like to provide some feedback, please feel free to stay and write something in the chat and complete the poll after our session today. Thank you all, and I'm wishing you a great day. Thank you for coming. Bye. Talk soon. Bye.